Okay. Assalamu alaikum. Before the introductory part 1 video, we have discussed what is periodontium and what are the components of periodontium. In the second video, how the components are important. If there is pathology in one periodontal component, it will affect the another component of the periodontium. Okay, so and it is also important that how the normal periodontium like gingiva, like pedia, like your bone, and like your cementum can, if it is normal, they will provide support and will maintain the function of the tooth. Okay, each structure of periodontium have different compositions, have different functions, and have different locations, but they will function as a together as a single unit, not as an individual, as a single unit. Okay, now it has also said that the matrix of each periodontal component will affect the activity of the adjacent structures. If any pathology come in one periodontal structure, so how it will affect the another structure. Okay, so next started like oral mucosa. You have studied in your first year what is oral mucosa. Mucosa is basically the lining of your body. It can line your respiratory tract, your GIT, your circulatory or system. We are talking about here specifically about oral mucosa. Oral mucosa, they have divided into three mucosas, or in three zones. You can say your masticatory mucosa, your specialized mucosa, and your specialized mucosa, and your lining mucosa. Respiratory mucosa, which contributes almost 25% of the oral mucosa, then your specialized mucosa contributes 15%, and the most contributing mucosa is your lining mucosa, which is almost 60%. Okay, respiratory mucosa will include your hard palate and your gingiva. Okay, your hard palate and gingiva. And the specialized mucosa will be the dorsum of the tongue and taste buds of the tongue. It's very important. And the lining mucosa is remaining your lips, cheeks, etc., all that mucosa. Okay, let's study it. What is gingiva? They have told that gingiva is basically the part of oral mucosa. Yes, it is a part of your oral mucosa that covers the alveolar processes of the jaws. Means if you have like this if you have seen the process, like if it's your bone, like this is your bone, right? In this shape, the gingiva will cover it in that pattern also. That also surrounds the neck of the teeth. Neck of the teeth means like if this is your tooth and this is the neck of the teeth. Okay, then dorsum, and this you are very familiar with this. Now coming to the basically about what is gingiva. क्लिनिकल फीचर्स क्या है इसके, ठीक है. सो लेट्स स्टडी दैट. अच्छा, इन अडल्ट नॉर्मल gingiva covers the alveolar bone, tooth root, and to a level of the cornea to cement in emergency. It is very important to remember the position of gingiva, especially the normal gingiva's position. It is actually just corona to the cemento-enamel junction. Okay, and it alveolar bone ko cover, it will cover it, and the tooth root. Okay, then they have also anatomically divided marginal gingiva, attached gingiva, and interdental gingiva. Each part, or each type of gingiva shows different variations in their differentiation. They are different in their histology, in their thickness, according to, even because they have different function demands. Okay, they have different function demands, and all have been taken and specifically structured to function appropriately against like mechanical and microbial damage, or it can protect against any trauma. In other words, specific structures like different parts of gingiva reflects each one's effectiveness. Like each gingiva type will shows, yeah, it reflects the effectiveness against the barrier mean to penetration by the microbes, yeah, any nauseous agents in your deeper tissues. Okay, in the next video we will talk about the marginal gingiva and the attached gingiva and your interdental gingiva.